Hi, I'm Dr. John Minichetti. I'm the immediate past president of American Board of Oral and Implantology, and I am here interviewing our current president, Dr. Joseph Leonetti, president of the American Board of Oral and Implantology. So a little bit of background from about Dr. Joe before we start. Dr. Leonetti is currently the president of our ABOI. He's a graduate of Tufts University Dental School. He completed a fellowship in dental anesthesia at the Medical College of Pennsylvania and did a residency in oral maxillofacial surgery at the New York Hospital, Bellevue Hospital in Manhattan. He's board certified with the American Board of Oral Medical Surgeons, and he is also board certified with the American Board of Oral and Implantology. He's currently an attending at Paola Memorial Hospital and Surgical Center, and he maintains a private practice in oral maxillofacial surgery at Mainline Center for Oral and Facial Surgery in Paola, Pennsylvania. So thank you for coming on, Dr. Leonetti.
My pleasure.
So I'm going to start with a general question. How, you just became president and we have certain people on our board. So maybe you could just tell us how often are board members elected and how do potential candidates get selected for the ABOI board?
Yeah, certainly, John. As you know, the ABOI board consists of 7 members, and those 7 members are elected for a 7-year term. And each year they rotate through various positions. And after serving as president, you remain on the board as the immediate past president, which is now the position you are in. As far as how they're selected, that's a very interesting process, because I think there's no real set way other than the fact they need to be diplomats of the ABOI. So as the board meets new people through the credentialing process, and also as candidates that have gone through the credentialing process express their interest, we try to get them involved in some way, such as my own story, and eventually, if they're interested enough, we'll nominate them, and then they will be elected by the membership. And we make, as a board, a recommendation to the membership, but the membership is allowed to also nominate anyone that they feel that they would like to see have an opportunity. So it's a very democratic process, and it's one that I would urge our membership to pursue, because it's a wonderful and gratifying privilege to serve on the board, on behalf of our membership.
Well, congratulations on your election. I know you worked very, very hard for this board, and we do appreciate all your efforts. So my second question is really about, the board's mission. If you go on the website, the board's mission is to certify individuals at the highest standard of competency in diagnosis, surgery, and prosthetic treatment in the specialty of implant dentistry. And it's also to ensure that their current knowledge and skills are for the safety of the public. So what about this ABOI mission excites you so much that you've become so involved with our ABOI and actually leading the president?
Yes, I mean, certainly the board's been in existence for many years. I think it's 1969 or so. And while our primary mission is to assess candidates that challenge the board, this is a very, I think, exciting time for the ABOI. Certainly in the last 15 years or so, we've seen the number of implants placed in this country increasing by almost double digits. Whereas prior to 2000, I think it was less than 1% increase per year. And, there's 200 or so thousand dentists in the United States placing approximately 5 million implants per year. But yet only about 15% of our colleagues in dentistry place implants. Whereas in the rest of the world, especially in Europe, it's 80 or 90%. So this is a very critical time in our growth, not only as a board, but just as a specialty of colleagues who want to expand their private practice And that's what excites me the most, to be involved in the strategic planning of how we're going to get the people trained to the point that they can challenge the board, and then the board can remain a viable validation for that training and move forward into the future.
Beautiful. Yeah, so we mentioned before the selection process and involvement with the ABOI. So how did you become involved with the ABOI?
Yeah, again, getting back to how you get selected for the board, I happen to have been asked to give a seminar during one of the AAID national meetings, and I immediately became very interested in this organization because upon sitting in the general session and listening to the various speakers, I felt that it really filled a gap in my own education, because as a specialist, I really did not have any residency training specific to dental implantology. I certainly didn't have any specific training in prosthetics. So I felt like it was a collegial opportunity when I saw lectures that not only talked about what I'm comfortable with, which is surgery, but prosthetics, implants, and the like. And I decided to try to become a diplomat. And I did it through credentialing, which is one of our pathways, which we can talk about. And then once I became credentialed, I decided that I'd like to be an examiner. And once I achieved that goal, and I found it very satisfying, very gratifying, I was asked by one of the past presidents on the board, who was still the immediate past president, to consider serving on the board. And that was my path. And I think that's a similar path for a lot of people once they get to see what's going on, the exciting things that are happening at the AAID.
That's great. That's great. Yeah, it's about getting involved, and then you've epitomized that. So as a specialist, because you're an oral maxillofacial specialist, and you're boarded with two specialties, what experience do you bring to the ABOI presidential position?
Well, I think getting back to the credentialing for ABOI status or diplomat status, I feel like I've walked in a similar path as many of almost all of our membership, in that being a specialist did not in any way, shape, or form allow me to just walk through the process. I had a certain path that was designed for people who had prior training, such as I, but I still needed to, learn all the different things that make someone a really good surgical and restorative implantologist. So having shared that experience, I think now that I'm in a position to serve on the board, I'm able to not only have had that experience with the membership, but now I listen to the membership and I hear a lot of their concerns and a lot of the challenges that I had in becoming a diplomat. And then, of course, having served for 6 years on the board, or 5 years prior to becoming president, I've been able to learn from people like you and participate in the day-to-day logistics of our organization. And I think that these all serve well to any incoming president. That shared experience, and then working for a number of years with our fellow board members.
Dr. Leonetti, so that leads me into the next question. From your perspective, what do you feel are some of the concerns of our diplomat members?
I think our diplomats have been very consistent, at least during my tenure as a board member, and in meeting them, whether it be through the preparation program we support, or the actual exam, or during our national meeting with AAID. I find that the concerns, there's a common thread, and it's been very positive, because I think that the membership is very happy with the leadership, because we remain laser focused on supporting them and their effort to become diplomats. Because again, in the absence of residency programs or the limited number of opportunities for residency programs at this point in time, our membership has to get the continuing education through other avenues, and we've been able to move forward in not only providing those opportunities, but and that's resulted in expanding our membership. So I think the number one concern they have is that they want to make sure we will continue to embrace the myriad of continuing education that they bring to the table in challenging the board, and we will allow those educational credentials to satisfy the requirements that we set up as a board. Secondly, and just as important, is they want to get involved in our organization, and sometimes they don't know how, because we have the one national meeting, and we need to continue to reach out to them because there's much talent out there. There's a lot of very talented people who I've met who I wonder why aren't they involved more, and a lot of it is just because of the lack of communication. It's very difficult sometimes to touch our members, which is why your efforts with social media and have been really helpful in trying to bridge that gap, and I hope we can continue to move in that path so we have this ongoing relationship with our members. Once they become diplomats, I want the relationship to blossom from that point.
Yeah, I want to commend you for your efforts. We just are starting to recently have discussions with our partner, the AAID, and we're working on these pathways. So kudos to you for being front forward, future empowered, and looking at different avenues to get our credentialed members through the pathway so they can become a diplomat. That's really great stuff. How has becoming board certified with the ABOI positively affected your practice professionally, for you personally?
Well, first of all, it certainly was on a personal level. It was just very gratifying to get competency and recognition for competency in something that I felt really lacked in my own specialty training. And over and above that, I found a new collegiality with my referral base, my community of dentists, who now I felt more comfortable speaking to about the three-dimensional aspect of implant dentistry versus just what I was, what I was accustomed to, which was just provide a surgical service. So now, when I'm with my colleagues and we're courses together, it might be courses where they're taking surgical courses with me and I'm taking restorative courses with them, or we're doing medical assessment together. So it's really satisfied me intellectually, and I think other board certified specialists are also finding a similar gratification by getting involved with ABOI.
Wonderful. So as a board certified oral maxillofacial surgeon, what do you feel the benefits of other specialists becoming involved with the American Board of Oral?
Yeah, again, one of the challenges obviously is at the present time, board certified and non-board certified specialists who have done residency training do have a pathway, and that pathway allows them to become by credential diplomats. Whereas if they needed to do a residency training program, for example, over and above the one they've already done, it might be a difficult lift for us to attract more and more specialists. I think the organization will always be an organization that's mostly restorative general practitioners, but there's no doubt in my mind that we all have something to offer, and we should welcome our specialty colleagues, and I think it's something that we need to remain focused on, and be inclusive. And then again, personally, it enabled me to market my practice a little differently, a little more aggressively, because there is the ABOI certification does, I think, provide, an opportunity for us to really communicate to the public that we are the experts. We are the people who are taking the time to get educated, to do the cases, get the expertise, and provide this service at the highest standards of care.
Super. Okay, so you're involved with the oral examination process, what everybody fears. This is your second year as serving as chair. So what advice would you give candidates to help them prepare for this ABOI board certification exam?
Well, first of all, I would advise anyone that's thinking about certification is to get started as soon as possible. And that's number one, because it can be a daunting task if you keep waiting and waiting and waiting to start your application. There's a lot of material that you need to provide, and sometimes when you're in private practice, you might not be as attentive to accumulating this material unless you know that you're doing it for a reason. Number two, there's no doubt in my mind that the only educational program that we provide is an excellent preparation for the oral exam and the written exam, which is our annual review course. And that annual review course is something that I take great pride in, and I inherited the opportunity to put that course on for the past 2 years, and it's prepared our candidates. At least that's what I hear, and our candidates are very happy. The reviews on the review course are stellar, and that's because we have tremendous faculty within our own membership that gives up, that participates in this course, and every year it seems to become more and more comprehensive because the specialty is expanding. And then the last advice, besides taking the course, I think that our candidates for the oral exam need to practice thinking on their feet and speaking. They need to put together small groups, study groups, and talk about cases, because that's what I think makes the oral exam difficult. We're not used to discussing cases with colleagues. We're used to discussing cases with patients. But when you're speaking to a colleague, you need to practice. And the only way to practice is to either put together a small study group or talk in front of a mirror. But I encourage my colleagues to get up on their feet and talk about these cases. And it makes you a better professional when you're able to do that.
Super good advice. So tell me about your personal, professional life, your family. Not everybody's your Facebook friend. So what interests do you have, etc.? Yeah.
Well, I've been practicing for 30 years. And during that time, I do indeed have many other interests outside of dentistry. One of my passions is I've been a high school baseball coach for many years. And so coaching is a very important part of my life. And I'm an avid golfer. My wife and my three children, we travel, and we enjoy the theater. We have a wonderful pet, a dog, and we live in Malvern. We spend some time in the summer at the New Jersey shore, and we're looking forward to more time together as the kids get older, because they're all out and about, as you know, and so we try to make time for each other, quality time. So that's pretty much my passions.
Wonderful. Okay, so I'm going to finish it up with, what do you feel are the biggest challenges facing the ABOI now and in the future?
In the beginning, we talked about this being a critical time, and I really believe that it is a critical time, because as the the population of dentists start to place more and more implants, and we get to a point where there are maybe 90%, like in Europe, of our dental community placing implants. The challenge for our board is to continue to assess these people. And I really feel like if I were to look into the future and in 20 years or 30 years, maybe we would have enough residency programs, hospital-based, dental school-based programs, full-time programs, where we were going to every year graduate enough people with specific surgical, prosthetic experience in implant dentistry, that can be the sole pathway to board certification, much like many of the ADA specialties now. But I really believe it might be a slippery slope if we try to move too quickly, because the membership needs to remain our primary focus. And I, for one, do not want to see our membership ever feel that our board is losing track of our primary mission, which is to serve those members that are presently practicing, and while at the same time embracing any kind of additional continuing education programs. But that is not our primary mission, to develop those programs. Our mission is to assess the playing field as it exists and continue to move forward in ways that protect the public. So I think our challenge is to not move too quickly and be cautious to protect this wonderful foundation that we have all had a part in developing.
Well, thank you, Dr. Leonetti. That's great. I want to thank you for coming on this evening and sharing some of your thoughts. And I know the ABOI members and potential members are in great hands under your leadership. So thank you so much.
And thank you, John, for your wonderful service to the ABOI.